Hello, my name is Dan Brock, Practice Director of Healthcare at Branchburg. I'm here to show you yet another use case leveraging our data discovery and healthcare solution that comes from real customer data, real world data that's been de-identified to protect patient identity. If you haven't seen it already, please check out some of our other installments. In a previous installment, I walked through how a hospital administrator might leverage this solution to understand readmission rates a little bit better. For the purposes of today's installment, I'm actually going to put on the hat of a clinical researcher. And in this particular instance, the researcher is interested in identifying patients who have had tumor relapses because he's interested in formulating a clinical trial for a new chemotherapy drug. And he's going to sit down with our data discovery solution to ask the right questions of the data to find out who the best candidates are, who the best patients are to participate in his clinical trial. So like I said, for the purposes of the trial, I need to identify patients under the age of 21 who have had a relapse of tumors. So real quickly, and again, if you haven't seen any of our other installments, please take a look, because I spent some time in those installments to orient you to what it is the data is you're looking at and the dashboard itself. So again, if I'm looking for patients under the age of 21, I'm going to refine by those patients who were born after 1994. And I need patients that have experienced a relapse of tumors. So there's a couple keywords there I want to search for. And as always, the solution is going to offer me the attributes within the structured data where it finds the term relapse. But as we've seen in previous use cases, sometimes I want to cast that wider net and just look for any mention of the term relapse, either on the structured data or the unstructured medical note. So I'm going to go ahead and search for relapse on top of my patients who are 21 and under. So now I'm looking at still a significant but a reasonable subset of patients who fit that criteria. Layered on top of that search, I'm also going to look for mention of the term tumor, because again, I'm looking for tumor relapses. And I could certainly dive right into a brain tumor as a diagnosis, but as we've seen in the past, that can often be too restrictive. So I'm going to, again, leverage fully featured search here and look across the entirety of the record for mention of tumor. So now I'm down to even a much more reasonable subset of patients, 248. At any time I can come down and see exactly who these patients are. But for the purposes of my study, I might actually want to make sure that these patients have been in the hospital before and come through our oncology department. So I'm actually going to take advantage of the type ahead functionality here and make sure that they've been through our medical service oncology department. And now I'm looking at a very reasonable subset of patients, 6 in this case. Of course, those 6 patients I can identify right down here in our patients table. But before I do, because I will require these patients to visit the hospital, I'm actually going to apply a last-minute geospatial filter to make sure that I'm only asking patients to come to the hospital who live within about a 30-mile radius. So I filter a couple more out, and I'm looking at 5 patients who I can then turn around and call. I can bookmark this. I can also export this patient list and to a result table, email it to my colleagues, whomever I choose to. But again, another case for how this solution might be used, and this time for a clinical researcher. Thank you.